now to mandatory testing, what is likely to happen? Are we likely going to see more of this going underground for fear that once I'm tested positive, my status is going to be disclosed to the third party? So we need to think about that. And yet we have gone a long way. I think to date, quite a number are now coming out willingly to test, to be able to test. So we are not sure of what is going to happen.
Welcome back. You're still watching the show, and we're discussing the HIV and AIDS Prevention and Control Act 2014. I have an audience of Ugandans. I also have a panel here comprised of Dr. Stephen Watiti, Joyce Matovu, and Dr. Penna Itung Amor. I want to take back this issue to you, the people. We had Mastula Nakisozi, if I'm correct, and you had a story to tell. If you can make your story very punchy and short, you have a microphone. Please, Mastula, this is the moment.
Thank you so much. I'm called Mastula Nakisozi. I'm a home-based caregiver working with Kawempe Home-Based Care Alliance. This is a true story because when I was tested HIV positive in 2005, and then when my husband passed away, there was a disclosure. Whenever people came at home, they used to disclose to those people that is the one who brought the disease. So it affected me so much to the extent that the community members did not allow my child to play with theirs. So in that case, if it was not for the rescue of one of the non-government organizations, I would be in the grave by now. I'm so grateful that we are given ARVs, but if we continue with this law, especially that clause, are we really going ahead with the people infected by HIV/AIDS? Because I can see that stigma and discrimination of the highest order is now becoming back. And I don't think if they force people, it seems as if they are judging us that you did a crime to be HIV positive. So I think the law is not in the way to help the infected people. Otherwise, we are going to lose our lives so much.
Okay. All right. Well, Dr. Watiti, first of all, how can one be sure even that Nakisozi's problem was caused by Nakisozi and not her late husband or somebody else?
Yes, and that is the gist of the matter. In that, this law puts the burden of preventing new HIV infections upon those who have tested and know it. If you have not tested and don't know it, even if you have the disease, it is not what. Preventing new infection should be a passion for all of us, because nobody gains, those who are already positive and those who are not positive. But if it should be, preventing new infection should be a shared responsibility of those who are positive and know it, and those who are negative and know it. The problem is the majority of the Ugandans don't know their status. And this law, by putting it this way, is going to make it difficult. First, then the other thing is that many Ugandans are going to go around it. Instead of me going to register as Watiti when I go to AIC, I will say I'm Masaba. So when you take me to court, you would find Masaba's results. Where is Watiti? I am not there. Because there is a weakness. Preventing new infection, there is no evidence that it is Nakisozi who infected the husband.
Isn't the issue that has been raised by Nakisozi really a concern of the counsellors? They have not done enough of counselling to fight this stigma, because if the people of Uganda knew, they wouldn't be attacking her. If they know, I mean, that shouldn't raise an issue. So you, the counsellors, you, the psychologists, need to do much more.
Yeah, I think we have done a lot. There has been a lot of sensitizations in the communities, and really by now I don't think that we should have an issue with stigma. But because of these issues now coming, these new bills, I think we are going to go back to where we started from. For example, her husband dying doesn't mean that she's the one who brought the what. First and foremost, nobody ever tested them to see who brought the what, the disease. Secondly, where we are right now, we don't have the technology to know who brought the what, the disease. And in any case, that's not the issue. If the disease has set in the house, all we are looking at now is making sure that somebody copes up what, well. We don't need to look at the what, the past. We are dealing with the present and the what? The future.
Dr.
We want our people
is
to
that
live.
True? There's no technology to tell and look at the history of the disease by looking through the DNA of the disease using molecular science and molecular biology? Isn't it possible?
But we can't afford it.
It is
as
possible.
A country.
The science is there.
The science is there. You can know the different variants of HIV. You know whether this, is it the same? But we can't afford it as a country. And if we are thinking about controlling this disease in a public health, using a public health approach, that's the last place that we should be investing our resources.
I'm seated here with the whole bureau chief for Africa, AIDS Healthcare Foundation. The money should be there. It's about saving humanity, isn't it?
Yes, but I mean, why spend money on something like that? Yet there are so many people who are still dying and don't have access to ARVs. Just looking at the reports from the Uganda AIDS Commission, much as we've made a lot of headway and almost doubled the number of patients on ARVs over the past 2 years, but we have a deficit of about 500,000 more who need ARVs. So why not spend money on saving more lives and also on cheaper things like having other prevention methods, condoms, scaling up some of those prevention methods that have been proven to work, and waste it on something like that.
Okay, it looks like you provoked the audience, so let me go back to the audience and maybe hear from them. Israel Bandeke, you had a story to tell. Maybe my colleague should give you a microphone so that we can hear from you. Make it very short, Israel.
Thank you, moderator. I'm Bendachi Israel. I'm 52 years. I'm a client of Tasso Murago branch. I tested HIV positive in 1990. I joined Tasso 1993. Then it happened in 1993. I disclosed through Weekly Topic, which was a newspaper of that time, and Daily Monitor. I disclosed that I'm HIV positive. People who are near to me here in Kampala rushed to the village, telling my parents, my relatives, that Israel will come in the coffin. It happened in... and
probably some of them have gone to the grave before you.
It happened in 2010 when I was terminally sick and bedridden. Then my father also was sick. People were counting who will die first. We are counting days, hours, minutes, and seconds. My father died. After the death of my father, my sisters shared the whole of the property with their children, leaving me with nothing.
Because they thought you didn't have a future?
Yeah. So, for me, I disclosed voluntarily. But now, if it becomes a bill that someone will disclose your status without your consent, what will happen in the future? Thank you very much.
So, well, we have another case, which is more or less like Israel's case there, of a story of somebody else. I think that is going to be Nakidi Mary.
Nze najja emalago n'enkeberebwa ng'omwana wange mulwadde nga ndi lubuto. Omwana wange bwe nali olubuto ne bankebera ne basanga nga ndi mulwadde ne baŋŋamba ndeete n'omuto olubuto gwe lwali luddako ne bamukebera n'asangibwa nga mulwadde ne batuwa eddagala nga ne baŋŋamba nti ŋŋende ntandika okuliwa omwana omuto. Bwe natuuka awaka omwami ne ndimulaga nga bamuntumye ajje naye bamukebere. Omwami olwakimanya n'angoba n'aŋŋamba nti wano ye tabeera na balwadde era ye tajja kusobola kubeera naki, ffe tumanyi gye twajja obulwadde bwaffe, n'atugoba n'omwana bwe namuzaala ne mbeera mu mbeera mbi nga siina kyakulya siina kyakunywa ne ŋŋenda mu bakadde nnyo abazaala maama bakyala babiri nga be bazaala maama ne ŋŋenda n'embeera eyo omwana n'anfaako ne mmubikira era n'angobya omulambo ne nguziika ewa jjajja azaala maama n'omwana bwe namutwalayo ng'akuzeemu ne yasigalawo omulwadde ali ku ddagala n'amungobya n'amungobya era tasoma n'okusoma.
It's a sad story of Nakidi Mary, who tested positive and had children in Milago. And when she took the news to the husband, she was chased on the account that the husband does not live with people who are diseased, that they should take back the disease where they got it from. Mary had to go back to her parents, and when she lost her child, her husband made her also chased her with the dead body. That's the sad story of Mary Nakidi. Maybe, Penna, you have a point.
Yes, that's the reality that we face on the ground. And sometimes, when legislators pass certain laws, I think they forget the reality, the day-to-day reality that the majority of Ugandans actually face. Her story is not very uncommon. It's actually quite common, of where people go home voluntarily and disclose to their partners, and they are chased from their homes, or they are beaten up, or they are segregated against. So imagine if people are doing that on voluntary basis, and the repercussions are like that. Now, when you make it a bill, and it's mandatory for the husband to be brought in, and it's mandatory for the health worker to go ahead and disclose those results, what will be the repercussions? What should we as a country be doing instead? What we should do is invest more in our counsellors. We empower them more. Let's invest more in community structures that can actually support patients at that level. Let's invest more in reducing the amount of stigma, because it has overall repercussions of seeking health services.
Everybody hears the story of Mary Nakide, and everybody sympathizes with her. But these legislators of Uganda are saying, look, we cannot bury our heads in the sand like the proverbial ostrich and assume there's no problem. We've got to move. Some measures are going to be drastic, but I think they will take us there. Dr. Watiti.
Yeah, I think the intention was right, but the reality is going to be different. We want all women tested, but as you can see, most men, when they are told, any person who is told in the village, in our villages, pick anything, is that the one most people think, and I know this from experience, that think the one who tested first is the one who brought the disease. And then second, you talked about counselors. Let's go to Chenjojo. I come from Mbale. My village is called Kisahuru. And our health center is called the Busano Health Center 3. You go there for testing. There are no counselors. The people who are there are mainly the people living with HIV who are trying to give experiential counseling. We don't have trained psychologists to handle such complex issues. That's a very complex issue. You see it happened long ago, but see the things are so we are putting in a law in a place where there are no counselors. Health center for example, are supposed to be manned by doctors. I bet you go to a health center and find a doctor there, in the afternoon especially. So this is a law which is coming, and yet we are telling people to go and test, but on the ground it's going to do more harm. First and foremost, forcing this one he actually did not was not forced. But now when any person who hears this story will say, I will not tell the husband. I've counseled many women and say, go and tell the husband. Say, I'm not going to tell him. I'll take the condoms, but when you take condoms home, they say, why you bring condoms? Because they're asking, why are you bringing condoms? You are my wife. We need to do more education. More money should be put in health education other than in creating laws.
Joyce, what needs to be done now? The law is here. What do you want as civil society, as councillors, as psychologists? What do you want the parliament and the lawmakers to do?
Going back to her story, briefly, we have seen she had taken an initiative to go back and tell the partner. But of course, we've had very many male partners who are not coming on board. And this bill is telling men, all partners, to be what? Tested. But where are we going to get the men from? Because even while as I talk now, in Mulaga alone, we only have, with all the efforts that we have put in place, that is calling them on radios, giving them letters to come on board to be tested, we are only getting 20% of men doing what? Coming on board to be tested. Where shall we get the partners from? We need more strategies then in the community.
What you are telling us is that there is a need for you to have them tested, and whereas you want 100%, you have 20. So they have put a law to help you to bring them, because you want them.
We are now talking about reality. You know, many times these bills are passed without considering the reality or going back to the ground. When you go to the ground, that is not going to happen. So we need more not gentle, but strategies which are going to be very helpful, like going really back to the grassroots to sensitize and mobilize people on these issues, so that we support them, even if they are not psychologists like at this level, but we can train. We have so many people that can be trained in the communities, lay people, lay men and women who can be trained to help these people or support these people on all these issues coming out.
think, Patrick, as you said, these areas which you have mentioned, Parliament still can revisit them. These things are not written in rock. As experts and many others would say, that we can change. For example, why do you use force? When no force has been used, and like Dr. Penna has said, we have reduced the prevalence from, the prevalence amongst newborns from 25,000 annually to now about 8,000 without a law, by just teaching the people. We need more resources put in service delivery other than putting laws. Of course, there are those errant people who will need force. But as somebody in the audience said, there are already laws if somebody is intentionally transmitting, although that is also difficult to prove in a court. I don't know, I'm not a lawyer, but as a doctor, if two people come, how are you going to prove that the one was intentionally transmitting HIV? Unless this person is forced, that man with a lot of money in Chenjojo or wherever, is forcing people, and there is a law against forcing people into sex, or going with underage children, or those with mental disabilities. But the masses, people should be told what we are telling everyone now, that there is HIV. It should be the responsibility of those people who are negative and know it to protect themselves, instead of putting the burden on those who are positive and know it.
And at that point, we are going to take a break. We'll be right back.
The disclosure of HIV status, whereas it allows public health providers to discretion to disclose depending on the condition. But again, this contravenes Section 42, which is again about breach of confidentiality. It contradicts that clause. And there is actually the law is very clear.